Everyone, now let us discuss about 2023 ICD-10 coding guidelines for Chapter 9, Part 2. Chapter 9 deals with diseases of circulatory system. In the current session, we will be focusing on the remaining hypertension topic. So as we have discussed earlier, the coding guidelines are categorized into 5 types: hypertension, atherosclerotic coronary artery disease and angina, intraoperative and post-procedural cerebrovascular accident, sequelae of cerebrovascular disease, acute myocardial infarction. Here we will be discussing about continuation of hypertension. So first let us discuss about hypertensive chronic kidney disease. Hypertension associated with CKD. In the part 1, we have discussed that both heart involvement and kidney involvement are considered as related conditions for hypertension. So assign code from category 1 to 12, I12. Assign the code from category I12, hypertensive chronic kidney disease, when both hypertension and a condition classifiable to N18, chronic kidney disease, and N26 are present. CKD should not be coded as hypertensive if the provider indicates that CKD is not related to hypertension. CKD should not be coded as hypertensive if the provider indicates that CKD is not related to hypertension. Appropriate codes from category N18 should be used as a secondary diagnosis, and code from category I12 along with the code from category I12 to identify the stage of chronic kidney disease. And if the patient has hypertensive chronic kidney disease and acute renal failure, an additional code for acute renal failure is also required. This is also important. If the patient has hypertensive chronic kidney disease and acute renal failure, an additional code for the acute renal failure is also required. Now, if you see under the tabular list, I12 code. I12 is nothing but hypertensive chronic kidney disease. Under this, you can find the includes note. Any condition in N18 and N26. That is why in the previous slide I have discussed N26. Not only chronic kidney disease, conditions that are classified under N26. Any condition in N18 and N26 due to hypertension is included in I12 series. You can find this in the tabular list. And also atherosclerosis of disease. Whenever hypertension is associated with atherosclerosis of kidney, atherosclerotic nephritis, chronic or interstitial, hypertensive nephropathy, and nephrosclerosis. In all these conditions and any condition in N18 and N26, you need to assign only I12 code for hypertension, not I10. What are the conditions that are classified under N18 and N26? And also atherosclerosis of kidney, atherosclerotic nephritis. It can be either chronic or interstitial, hypertensive nephropathy, nephrosclerosis. Whenever physician documents any of these terms, then you need to code I12. You can find excludes one. Excludes one means these two codes should not be coded together. Excludes one indicates hypertension due to kidney disease, which comes under secondary hypertension codes, and renovascular hypertension, secondary hypertension. These three codes are excluded. That is, you should not code I12 and I15 together. Excludes two. Excludes two means they are not related, but they can be coded together. As said earlier, if the patient has chronic kidney disease and also acute renal failure, you need to use the code acute renal failure also. So whenever hypertensive chronic kidney disease is associated with acute renal failure, you can use an additional code from N17 because it comes under excludes 2. That indicates that both the conditions can be coded together. Now coming to I12 various codes. I12 is further categorized into I12.0 and I12.9. I12 indicates hypertensive chronic kidney disease. I12.0 indicates hypertensive chronic kidney disease with stage 5 or end stage renal disease. Whenever patient is suffering from stage 5 CKD or ESRD, that is end stage renal disease, you need to assign the code I12.0. Along with that, use additional code to identify the stage of chronic kidney disease, either N18.5 or N18.6. N18.6 for ESRD, N18.5 for CKD stage 5. Now coming to I12.9. This indicates hypertensive chronic kidney disease with stage 1 through stage 4. So whenever the patient is having hypertension and patient is suffering from stage 1 to stage 4 chronic kidney disease, or whenever patient is suffering from unspecified CKD, that is stage is not specified, in both the cases you need to code only I12.9. Additionally, use additional code to identify the stage of CKD. I12.9 is also called as hypertensive renal disease and hypertensive CKD NOS. Now we'll see the codes under N26. Previously we have discussed that it is included under I12. Conditions classified under N18 and N26. N26 indicates unspecified contracted kidney. N26.1 indicates atrophy of kidney terminal. N26.2 indicates page kidney. N26.9 indicates renal sclerosis unspecified. So whenever hypertensive patient is suffering from above listed conditions, it can be atrophy of kidney terminal stage, page kidney or renal sclerosis, we need to assign code I12 not I10. Let us see an example. Hypertensive patient with page kidney. So first you need to code I12.9 to indicate hypertensive renal disease NOS, followed by N26.2 to indicate page kidney. Usually we all know that N18 series is related to I12, but additionally N26 should also be considered, which is given under tabular list. Let us discuss an example. Hypertensive patient with history of stage 2 CKD undergoing dialysis for ESRD. Here the patient is having history of stage 2 CKD and now currently is undergoing dialysis for end stage renal disease. So the disease has progressed. Then you need to code ESRD not stage 2. So the appropriate codes for this scenario are I12.0 to indicate hypertensive chronic kidney disease with stage 5 or end stage renal disease, and N18.6 to indicate end stage renal disease, and Z99.2 to indicate hemodialysis status because patient is undergoing dialysis for end stage renal disease. One important note is if both a stage of CKD and end stage renal disease are documented, then assign code N18.6 only. You need not code additionally lower stage of CKD because this is the highest end stage renal disease is the highest stage of CKD. Whenever highest stage is documented, you need to code only SRD, that is N18.6. Let us see one more example. Diabetic patient suffering from hypertensive chronic kidney disease stage 2 presents for regular follow-up. Here, patient is diabetic and he is suffering from hypertension and CKD. So, first E11.22, type 2 diabetes with diabetic chronic kidney disease, followed by I12.9 to indicate hypertensive chronic kidney disease with stage 1 through stage 4 chronic kidney disease or unspecified chronic kidney disease. Because here he is mentioning stage 2, you need to code I12.9 followed by N18.2 to indicate the stage, that is chronic kidney disease stage 2 or mild. Now coming to next scenario, hypertensive heart and chronic kidney disease. That is the patient will be suffering from hypertension along with heart condition and CKD. Assign codes from combination category I13, hypertensive heart and chronic kidney disease, when there is hypertension and with both heart and kidney involvement. If heart failure is present, assign an additional code from the category I50 to identify the type of heart failure. And the appropriate code from category N18, chronic kidney disease, should also be used as secondary code with a code from category I13 to identify the stage of CKD. For patients with both acute renal failure and chronic kidney disease, an additional code for acute renal failure is also required. Here you can see the various scenarios. The first is I13. I13 indicates hypertensive heart and chronic kidney disease. There are two scenarios here. Hypertensive heart and chronic kidney disease with heart failure, and hypertensive heart and chronic kidney disease without heart failure. So, with heart failure codes are again categorized based on the stage of CKD. Hypertensive heart with heart failure through stages 1 to 4 of CKD or unspecified CKD. In all these cases, the final code is I13.0. So, the patient is suffering from heart failure and chronic kidney disease in the stage 1 to 4 or unspecified. Then you need to quote first I13.0 followed by code for heart failure from I50 series, then code for CKD from N18 series. Therefore, three codes are required. Whenever patient is suffering with heart failure, CKD and CKD. Next case is patient is suffering with heart failure with stage 5 CKD or end stage renal disease. Then the code is I13.2. Here they are not indicated in a numerical sequence, so don't get confused. For patient with heart failure and stages CKD 5 or end stage renal disease, the final code is I13.2. Even in this case also there are three codes. First I13.2 to indicate hypertensive heart and CKD with stage 5 or ESRD, followed by type of heart failure and then stage of CKD. Next, coming to second case, hypertensive heart failure, hypertensive heart and CKD without heart failure. Here patient is not having heart failure. Here the codes are again categorized based upon the stages of CKD. Patient is having hypertensive heart and CKD without heart failure and the CKD stages are from 1 to 4 or unspecified. Then the appropriate code is I13.10. And for CKD stage 5 or ESRD, the code is I13.11. I13.10 and I13.11 indicate without heart failure codes, whereas I13.0 and I13.2 indicate with heart failure codes. Don't get confused. Now let us see an example. A patient visits for regular follow-up, past medical history of heart failure with reduced ejection fraction, HFrEF, hypertension and stage 2 CKD, and no other complaints today, comes for medication refill. So patient is having heart failure, CKD, hypertension. So the appropriate code is I13.0. Hypertensive and chronic kidney disease with the heart failure. Here the CKD stage is 2. So stage 1 through 4 or unspecified CKD. Followed by I50.20 to indicate heart failure with reduced ejection fraction, HFrEF. And finally N18.2 to indicate stage 2 of CKD. Now let us see one more example. A patient presents with cardiomegaly, past medical history, hypertension and stage 2 CKD. No other complaints, medication refills are done. So the appropriate patient is having heart related condition and hypertension and stage 2 CKD, but he is not having heart failure. So the appropriate code is I13.10, hypertensive and chronic kidney disease without heart failure, and the stage of CKD is 2, stage 2. So stage 1 through stage 4 or unspecified CKD. Followed by I51.7 to indicate cardiomegaly and N18.2 to indicate chronic kidney disease stage 2. I hope you understood what is the difference between with heart failure and without heart failure and the appropriate codes. They are not in a numerical sequence. That thing you need to remember. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.